Of us use apps like Uber or Lyft that bring a driver to our door, but now a new smartphone app in Atlanta brings a doctor to your home. It's called Heal. As the Fox Medical Team's Beth Galvin tells us, it's changing how some locals get their health care.
And good morning, Elise. Yes, Heal is actually a kind of a house call app. You download it, you type in what kind of medical problem you're having, and you set up a 2-hour window for a visit. There's no drive to your doctor's office. There's no waiting in the waiting room because this doctor comes to you. When Lisa Zawacki needs to see the doctor, she skips the drive and the wait thanks to a house call delivery app known as Heal that brings the doctor to her door.
A lot of times at a doctor's office, you're waiting around. They're an hour or so late. And with Heal, you have the time. They come to you. It's super convenient.
Today, internist Dr. Willette Davis is making the rounds with a medical assistant. She's new to Heal, and Heal is new to Atlanta, launching in January of 2019. But Davis has spent 20 years working in a traditional practice.
When I did outpatient medicine, there was a rush to get patients through, and I think the patients felt like they were being cycled through, and the doctors felt that too.
With Heal, the doctor comes to you, they sit down, and they spend 20 or 30 minutes going over everything.
And Dr. Davis likes the old school intimacy of making house calls.
To be able to come into a home, spend an hour with the patient, get to know them, get to know their full history, know that they can come back, we can call them, we can follow up with them. It just changes the whole paradigm of healthcare delivery.
Heal physicians handle primary, urgent, even pediatric care 365 days a year, including holidays and weekends. House calls are $149 if you're self-paying, but many insurance plans from Medicare to Aetna to Anthem Blue Cross and United Healthcare cover these visits. And Bill Custer, a professor at the Institute for Health Administration at Georgia State University, says it makes sense.
A lot of insurers are seeing this as a way that they can reduce costs. That is, having people have regular primary care reduces the probability they'll go to an emergency room or a hospital.
Especially when you're not feeling well, to not have to leave the house and have the doctor come to you is fantastic.
And Lisa still has a primary care doctor, but she uses Heal for most of her medical needs. And the app launched in California 4 years ago. It's now expanded to Atlanta, Washington, D.C., and Northern Virginia. And our producer, Susan, said she did not actually even have to download the app. She just went to the website and was able to get a doctor. And under her copay, she didn't have to pay anything for the visit. So it's really something to think about. That's really, I think, going to change the dynamic of how we get our health care.
Yeah, and it's even thinking about, you know, if you have sick kids, this could be
absolutely. They have
good
pediatricians, yes.
Yeah, for sure. Okay, so can you see how much you'll pay, though, before you book the appointment?
Yes. Heal says they have complete transparency, that you'll be able to see how much you're going to pay before you book the appointment or see the doctor, and they say that they will not send you any bills later.
Wow.
Yeah.
Wow. Okay, so what kinds of things can the doctor and that medical assistant do when they come to your house?
So they can do a lot of things that they could do in a typical primary care setting. So they can test your vital signs, they can draw labs, they can run some basic tests there. Now, one thing that Heal's not probably going to be really a great fit for is when you really do have a very urgent medical need. You're having chest pain, you're having difficulty breathing. That's a 911 call, not a house call kind of thing. You know, that's when you need to go to the emergency room or get get to the ER, I would say.
So it's what you would typically, go and see your doctor for. That's what they can help you with.
Absolutely. They will come to you.
Wow, that is fascinating. So cool. And it's neat too. I mean, we got the email about our insurance being one of those that helps to cover this. And so it's worth looking into.
It
for
is.
sure. Yeah. Beth, thank you, Beth. We appreciate it.